The hype about the iPhone has put mobile phone software under the microscope. But imagine if your phone could ask you about your day. Imagine if it could log your moods and diet to relay to your doctor. Now imagine that you have depression, and that part you probably don't have to imagine too hard, as 1 in 5 of us will suffer from depression at some point in our lives. Depression is the most common form of mental illness.
So what it is a little program that runs on mobile phones, and it tracks young people's experiences. So what they do is they complete this program 4 times a day. So we send them SMSs 4 times a day to prompt them to complete the program. And it asks them questions about their mood and how they're feeling, any stresses that have occurred, and just about their daily activities, so what they're doing and things like that. We run it in clinics, so when the young person comes back to see their doctor, the doctor can bring up their data on a secure website and see pretty graphs of their mood and tables of what stresses have occurred and how they're coping with those stresses. And that way the doctor can get a really good idea about what the young person's doing with their time, how they're coping, whether they're having, really bad moods all the time.
You said that it prompts the phone's user about how they have spent their day. How will it do this?
It's still an SMS is sent to the phone, but the SMS automatically opens the program. The phone beeps and the young person opens their phone to have a look at their message, and it's just the program has opened up. So they just log on and they can start entering data.
And how do they get this mobile phone software onto the mobiles?
At the moment, because we're trialling it in the clinical setting, we're giving young people mobile phones with the program already on it. The next phase of the project will be to make it compatible with all phones so that young people can simply go onto the website when they're in their doctor's office and download the program onto their phone. Yeah.
And does it counsel or offer words of support, or is it just a means of relaying information to the doctor?
It is just a monitoring program, so it doesn't tell them what they should be doing and that kind of thing. It just asks them how they're feeling. But there are also drop-down lists, so some of the lists are of coping strategies. The young people have reported that they see all the different things that are possible to do, and it gives them ideas about what they could do. So I'm looking at whether the effects of self-monitoring help these young people and how that occurs.
And do you think that this software could potentially stop depression in youth?
I don't think it's a standalone tool, but it definitely has benefits, and it's also a really good way of engaging young people. Young people love their mobile, so I think it's a really good way of engaging young people and making them more aware about their negative moods and about the different things they can do to help themselves.
Beyond Blue says that 1 in 5 people experience depression at some point. Do you think that this figure is unacceptable, or is it simply an illness that will at some point affect all of us?
With young people, the risk is increased, so it's a continuum rather than either being depressed or being non-depressed. People can experience different depressive symptoms, so I think it can strike anybody anytime. I think some people are more susceptible to depression.
How is diet important in relation to depression?
In the clinic that we've been running it in, at the Centre for Adolescent Health at the moment, there is a large proportion of young people that have eating disorders, so that's why the diet's included. It's not only just looking at depression, it's also looking at other factors that might impact on the young person's functioning, so mental as well as physical health.
Your software is a fresh concept that suggests that depression is not preventable, but able to be dealt with. True or false?
I think it is preventable, depression, yep. I think by giving young people this self-monitoring tool, they can become more aware of any negative moods they experience before they develop depressive symptoms. So by becoming more aware of their negative moods, they'll be able to cope with it better.
Mm-hmm. And how does the information reach the doctor?
On a secure website, so the data gets sent to a server at the Murdoch Children's Research Institute and gets put onto a secure website within the centre.
So does that mean that any doctor can be involved?
At the moment, we're trialling it here at the centre. We've just finished our trial here, and we've just begun trialling it at Bendigo, but hopefully the aim is to have it accessible to all doctors.
What further plans do you have for this research in the future?
For me, because I'm doing my PhD, my next study will be a randomised control trial. So that is, I'll have 2 groups of people. One group of these young people will be completing the mobile type program, and one of them will not. So there'll be a comparison of the two groups to see whether completing the program increases their awareness of their emotions and whether that leads to a reduction in any depressive symptoms that they might have.